Welcome to Skin Deep here on Sirius XM Radio, channel 141, HUR Voices. I'm your host, Sharon Morton, and thank you for, as always, for joining me from all over the world. Today, I have my special guest, physician and author, Dr. Bonita Coe, with me. Dr. Coe is an experienced internist and primary care physician practicing for the last 27 years. She's worked in a number of settings, including outpatient clinics, nursing homes, and hospitals where she has provided medical care to adult patients and taught medical students and residents in academic settings. She's currently working as a telemedicine primary care physician and does individual consulting for wellness and chronic disease management, as well as public speaking on health and wellness issues. And guess what? She's just published her first book titled How to Help Your Doctor Help You, a guide for men and women to manage health proactively. You can find her book on Barnes and Noble, Books A Million, and Amazon, as well as on her website. So we're gonna talk to Dr. Coe after the break. And as I always say, we're going to be doing more than just scratching the surface. Here on Skin Deep, we're talking all about how you can prevent and manage chronic illness and be a proactive partner in your healthcare. And by the way, if you want to reach out to me, email us at skindeepradioshow@gmail.com. In the meantime, I need you to stay tuned. We'll be right back after these messages with information you just can't afford to miss here on Sirius XM Radio, Skin Deep. And welcome back to Skin Deep here on Sirius XM. As I mentioned before the break, I have my special guest, physician and author, Dr. Bonita Coe, on the show with me. She just released her new book, How to Help Your Doctor Help You. I love that title. It's a guide for men and women to manage health proactively. Thank you so much, Dr. Coe. I call you Bonita. We can call you Dr. Bonita, however you want it. But I appreciate you being on the show.
Thank you for having me. Thank you.
You're welcome. So, as I mentioned, I love your book title, How to Help Your Doctor Help You. What inspired you to write the book, and what made you come up with that title?
So, I guess the main inspiration for me to write this book was taking care of patients over many years and having new patients and old patients come to see me and having them not know many things about their medical history and family history and being inexperienced in navigating their medical visits. And when I would coach them and guide them, patients would say to me so many times, why has nobody ever told me this? And after so many years of hearing this, I thought to myself, why do people not know this? And I said to myself, because it's not written down anywhere.
Yeah.
And so I said, maybe I should do this. And so the initial title of the book was Pearls from My Patients, because I would write down all the interesting quips and quotes and interesting things and pearls that patients would tell me that I wanted to pass on to other people. And it would start as sticky notes in my white coat, and it turned into a Word document, and then it turned into chapters. And this went on for the course of 15 years. And then I started dictating, and then it has just metamorphed into a book. And so I changed the title to really be How to Help Your Doctor Help You, to encourage people to be a proactive partner to help their doctor take care of them.
Well, I really like pearls for my patients. I like that too. that has everything to do with us being in Alpha Kappa Alpha Sorority Incorporated. But, anyway, I do like how to help your doctor help you, because a lot of times we as patients, and I'm saying that I'm not your patient, but I am a patient, we do have a lot of misconceptions about how to manage our health. Sometimes we're intimidated by the doctor when we go into a doctor's office. We're nervous. A lot of times we think doctors know everything, but everybody's different. all doctors are different, like patients are different, and we need to be more proactive and communicative with our doctors. How can patients better advocate for themselves when they're visiting the doctor?
Well, I address this in the book, and that's a big point of the book is giving people information to empower them to be more comfortable in navigating their doctor's visit. So it doesn't feel so you're not so fearful and it's not so daunting.
Hmm.
Um, but one thing is bring a notebook,
Yes,
write things down. Um,
very important. I
so
don't
you
think they can do that. I don't think people, number one, think about bringing a notebook to write things down. And number two, I don't think they think they're allowed to do that. I know when I go on doctor's visits, I always either take a notebook or put notes in my phone, or if I'm going with my husband, sometimes, and I'm not saying all men, but it's hard enough getting them to the doctor. But once you get them there, they're not really going to, not all men, but my husband's not going to take notes. So I take notes for him.
Oh, I love it when people bring a notebook. That means that I feel that the patient is going to take away from the visit all the things that we're discussing, and people are more likely to follow up and understand what's going on when they write things down. Also, bring someone with you who can corroborate what happened during the visit.
Yeah.
Um,
Yeah.
Ask your doctor, can you record? You know,
Right.
record on your phone. I, as a doctor, I don't mind if someone records. I mean, the recording is for you.
Yes.
Um,
Yes.
it's your personal information. Depending on your institution, you should ask to make sure that recording is allowed, but ask about that. But, most people don't need to actually record things. For many people, writing things down is really sufficient. And also have a health folder. So, all the paperwork, all your lab work, put it in a folder, have it in a bag or a briefcase so you can have all your health information in one place and
Yeah.
bring it with you to your visit, especially if you're seeing a new doctor.
And the other thing too is now with, of course, technology, like for me and my husband, we can just go into our healthcare portal and everything's there. All of our, the history of our health is there, which I really like. But it's still good to have those things at home as well. So I wanted to talk to you a little bit about um chronic illness. Like I seem to remember diseases like high blood pressure, diabetes, those kinds of diseases were more prevalent amongst older people, like over 50, 55, 60. We're starting to see a lot of these diseases in young people, like in their 30s. What is it that you think is going on besides maybe what's going on with the food? But what is it that is happening where we're seeing more and more people with these diseases? And what kind of advice can you give to people with chronic illnesses, Dr. Crow?
Well, I'll be honest with you. Maybe my vantage point is more skewed, but high blood pressure, diabetes, high cholesterol, the big three. In my career, I've always seen that in adults, even patients in their 20s, 30s, 40s. That's always been an issue. I think maybe people talk about it more. I think in the medical community, I think we screen for it more consistently in younger people.
Uh,
I would say that um, the food that we eat, just in my lifetime, the food that we eat is not, our eating habits are not as healthy as even when I was growing up.
right, right.
I think we now eat out more than we used to, which inherently is less healthy. So I think there's a little bit of that. But I think we have what we call a higher index of suspicion, and we have more consistent guidelines about screening even younger people for these conditions.
Oh, so you think that's why we're hearing more about younger people having these diseases that when I was coming up were, your grandmother and grandfather had those diseases.
Well, I think we talk about it more
Yeah.
and we exchange information more.
Yeah, and I was gonna ask you too, in terms of exchanging information, there's like a plethora of information out there. It's so overwhelming. How can people cut through all of the uh, overwhelming health information that's everywhere? I'm when I'm on Instagram or Facebook or whatever the platform is, it's like so much, and you don't know who to believe, who's a real doctor, who's not, what remedy to take, what remedy to stay away from. It's overwhelming.
Well, that was another big point of my book as I frame it, cutting sifting through the noise because there's so much information out there. And obviously, having a primary physician is the first resource to go to get reputable information. Also, looking, if you're going to use the internet, going to what we call peer reviewed sources, meaning sources and articles that are written by physicians, but it also at the top of the article says it's been reviewed by physicians to verify that the information is correct. And I don't have any stock in this company, but I will give a website that is actually excellent and peer reviewed. It's called Healthlines.
Okay.
If you look up at Healthlines, and I use this website to refer my patients to, it is an excellent website to go to, peer reviewed articles. And going to patient geared information at larger institutions like Cleveland Clinic or Mayo Clinic or Johns Hopkins or Howard University or
Yeah.
Morehouse. Those larger institutions, they have very good websites that have patient information, patient facing websites that are also peer reviewed versus just typing something in a browser.
Yeah. What did you say the website was? Did you say Health Lines? What did you say it was, Dr. Coe?
Healthlines, HEALTHLINES, healthlines.com.
Okay, that's great. And speaking of websites, let everybody know what your website is and again where they can find your book. I'm hoping your book is on your website, but I know it's also in Barnes and Noble. And
Yeah.
tell us
Yes.
where all of the good things are before we go to break.
Yes, you can find everything on my website at besthealthforyourlife.com. Besthealthforyourlife.com. I just updated it with my new book information.
Yeah.
So it's all there, including I started writing a monthly health newsletter a year ago. All my monthly health newsletters are on my website, and my book information is on the homepage of my website as well.
Good. So you all heard that. I need you to go to Dr. Coe's website and buy the book, How to Help Your Doctor Help You. Is that it?
That's it.
Yep. So we have to take a short break, folks. I want you to stay tuned. We'll be right back with information you just can't afford to miss here on Skin Deep on Sirius XM Radio. And we're back here on Skin Deep with physician and author Dr. Bonita Coe. She just released her new book, How to Help. Well, let me let you tell everybody, Dr. Coe. I keep saying, telling everybody, tell us about your new book. I think you just dropped it, right?
Yeah, so it was just released November 30th of 2024. It's called How to Help Your Doctor Help You, a guide for men and women to proactively manage health. And so, in addition to giving information about proactively managing health, um, talking about managing chronic illnesses, specifically, I look at the big three: high blood pressure, diabetes, high blood pressure. I spent a good deal of time in this book talking about eating healthy, making healthy food choices, and about losing weight. not focusing on medication, but making lifestyle changes. And I also spend a good deal of time in this book talking about lifestyle choices that can affect health.
Yeah.
Um, things that people don't think about, but can affect your health. Who you choose for a mate, what kind of job you choose, your circle of friends, how you treat people, all those things
Wow.
bleed into your doctor visit and can affect your health.
Wow, who you choose for a mate, that is amazing. How you choose your now the friends part I understand, but I want to get into that, who you choose for a mate and how that can affect. I know it can affect your mental and emotional and spiritual health, but I wasn't so certain about your physical health, but it does make sense. But before we embark on that, Dr. Coe, you were talking about the big three. You said high blood pressure, diabetes, and I think you meant to say high cholesterol.
Yeah, high
High
cholesterol.
cholesterol. So I suffer from high cholesterol. My doctor cannot figure out why, because I eat like a bird. I keep my weight down. My blood pressure is always down. I have great numbers in terms of the triglycerides and the what's the other one? There's three numbers. There's the uh
Total cholesterol, HDL, and LDL.
right.
And
The LDL is the bad one, right?
yes, the LDL is a bad one.
So I have really good HDL, really good triglycerides, but my LDL is bad, and I don't eat any dairy. I mean, I've given up all the bad stuff, all the stuff I love, the cheese, the dairy, all of that I love, pizza, and I still am battling this high cholesterol. My doctor keeps saying it's got to be hereditary, but no one in my family has high cholesterol.
It doesn't matter. So the answer is it very well may be what your doctor is saying, genetics, meaning that your parents can pass on the genes to you, even though they don't manifest the condition themselves.
Wow.
If they go to the doctor and get checked, if the doctor diagnoses them correctly or not.
That is like, it has been driving me crazy all of my life. I've really struggled to bring it down and just scared that, something could happen as a result of having high cholesterol, even though I eat like a bird. I just don't get that. So I'm going to talk to you after the show or maybe offline sometime about that. But in terms of what you said earlier about who you choose as a mate, that can impact your health. Does that mean if a man chooses a woman who cooks down home Southern food, that's how she got him as a husband? Is that what you mean? That's contributing
Uh,
to, of
uh,
course, different.
all of that. So mental health
Yeah,
affects physical health, meaning
true.
if your mental health is not optimal, you can't pay attention to physical health and all the things you need to do for that. So friction in the household, often when, like you alluded to, when you are trying to improve eating habits, it's very difficult if everybody else in the household is not on the same page with
Yeah,
respect to making healthy food choices. It's very hard. Adults, children have no say about what food's in the house.
right, right.
So that's what I mean by that.
And you also talked about friends having an impact on your health. Are you meaning like hanging out with the wrong folks? Like your parents used to say, don't hang out with that crowd. Is that what you're meaning?
All of that. Alcohol intake, smoking, stress, all that comes into play, with respect to your health. And so, as a physician, all of these topics come up when I take care of adults over the course of their lives. All of that comes up, and so I have a whole chapter in my book called "Through the Decades." And so, what this chapter is about, say you're reading this book at age 30, I take you through each decade of life and what things come up in people's lives, what things to look out for, what things come up in people's lives as at each decade of life as people go through their life journey.
Yeah.
like what age certain conditions come up, what age certain responsibilities start to happen.
Yeah.
And so that's a very important chapter, to start looking out for things and start doing things proactively to manage life, because life happens. You
Yeah.
can't stop these things from happening,
Right.
but you can think about and manage things proactively so they are not so impactful negatively on your health and your lifestyle.
Yeah, it is really hard when life happens, how to manage, for instance, stress. Like, I had the death of a very close loved one to occur 2 years ago, and I'm still trying to manage the grief, which can also play a role in the stress that I have as a result of that loss. And so I would think that one of the things that people who are going through, grieving or stress, uh, or you tell us, would you recommend going to therapy? What are some of the things that people can do to promote better health or improve their health when they're going through some changes?
Oh, absolutely. And I do spend time in the book talking about that because, as I mentioned before, you have to have optimal mental health to have good physical health. So, absolutely. I am of the mindset that just like you go to have a physical, there's nothing wrong with everybody checking in with a mental health professional once a year. What better way to do self care than to go talk to a professional and talk about yourself just to check in, make sure your thinking is okay, go over thought processes and challenges, that are maybe going on mentally, psychologically. A lot of times we're dealing with issues that have been going on since childhood, and a lot of those things creep up in adulthood and can hinder your progress as an adult. And so I always encourage people to consider mental health, counseling as a standard of care, as you go through life.
Yeah, very, very important. So we only have a couple of more minutes left, but can you share a success story of a patient who followed the advice that you have in your book?
Oh, absolutely. And I just won't give one particular patient, but I just can say collectively. Once again, I'll mention that in this book, I don't talk about medicine. I don't mention medication not one time. I think in general,
Good.
for those big three, high blood pressure, diabetes, and high cholesterol, outside of genetics, which is a big part of all of those three, people who actually, um, change their relationship with food, make an effort to change the paradigm of how they think about eating, eating for nutrition's sake instead of just taste, and emotional eating and all those things that we associate with food. People can actually reverse diabetes, reverse prediabetes, lose weight, improve blood pressure, improve cholesterol. And say you have all three, you can improve one and not improve the other. So having all three doesn't mean that they're all three genetically controlled. So it's always worthwhile to, make those eating changes. And so that's a collective success story. People can do it.
Yeah.
They
Yeah.
really, they really can. I've seen people do it over and over and over again.
Yeah, you can do whatever you put your mind to, that's for sure. So, Dr. Coe, I'm so happy that you were able to join me tonight, folks. That's it. I'm your host, Sharon Morton, with my wonderful guest, Dr. Bonita Coe. Dr. Coe, please tell everyone how they can reach you again and or order your book, How to Help Your Doctor Help You.
So certainly Bonita Coe, MD, you can put my name in on Amazon, Books a Million, or Barnes and Noble, or you can see the information on my website at besthealthforyourlife.com. All my information is there on my website. And also, you can sign up for my newsletter and fill out the contact form. You can reach me through my website, besthealthforyourlife.com.
Love it. Best Health, that's with a B, besthealthforyourlife.com. Thank you again, Dr. Coe. And folks, you can hear this show on Sirius XM Radio Channel 141 on Fridays, Saturdays, and Sundays, as well as on iTunes, Spotify, Stitcher, and all of the streaming platforms. And hit me up at skindeepradioshow@gmail.com or check me out at Sharon_Morton on Instagram and Facebook. Thanks again for tuning in on all things that are skin deep.